Hey guys, Dr. Jen Michelle Martin here, pelvic floor physical therapist. And I wanted to talk today about incontinence after surgical procedures, specifically replacement surgeries. So whether it's a knee replacement or it's a hip replacement, oftentimes there are a lot of people that will report issues with leaking for whatever reason after they've had this type of surgery. So I wanted to educate persons who may be dealing with these types of issues so that they can be aware of some of the expectations, what's normal, what's not normal, things of that sort. So we'll jump right in. So typically one of the things that you need to consider when you've had a replacement surgery is that you would have been anesthetized, whether it was general anesthesia, whether they did a spinal epidural, whatever the case may be, you would have been anesthetized during surgery. If it's general anesthesia, let me back up a little bit. If anesthesia has been used, then what you're going to find is that the body is going to shut down because the anesthesia will slow the systems of the body. And then coming out of anesthesia, some of the systems may still be a little sluggish. And so you may find issues like retention and so on after your surgery. If you've had an epidural type anesthesia, then what tends to happen is you might have retention a little bit longer, or you can have incontinence issues because that area is closer to the nerve roots that will innervate the bladder and that are responsible for direct contact with the bladder. So it is not uncommon that you will have those symptoms at that time. Similarly, you have to think of some of the other things that occur when you've had any type of surgery. Oftentimes the physicians and the nurses will administer fluids. And so when you think about them hanging the different bags of fluids and so on, you're getting a lot more fluids in your system. It can be a little bit overwhelming to your bladder. And so a lot of people will complain of increased frequency with that. Medication is another consideration. Oftentimes, most people will have some type of medication, whether it's opiate in form or if they have like morphine or something of the sort. Medications, these opioids, morphine, and so on, tend to have an effect where it constipates people. And if you're constipated, then what tends to happen is that the rectum continues to fill with feces, and that causes increased pressure within the pelvic cavity and thereby increased pressure on your bladder, which can lend itself to incontinence. Now, this is typical for all populations, not just post-surgical. So in general, people who tend to be constipated are more likely to have urinary incontinence accidents, whether it's children or adults alike. Nowadays, when you leave the hospital, you no longer have to have a bowel movement in order to leave. Once upon a time, that was a standard, and it's not that standard anymore. So oftentimes patients get discharged from the hospital after any type of replacement surgery, and they have not had a bowel movement. And it may be several days before they do have one. You also have to consider your lack of activity. So most joint replacement programs now implement a day one mobility program, whereby the patients are at least evaluated on the day of surgery. If they're not mobilized that day, then they're definitely mobilized the next day. But typically on day of surgery, most people are at least evaluated by physical therapy. And that may involve some mobility if they're able. This may be dependent on pain, the anesthesia, whether they're having symptoms of nausea, whether they're having dizziness, if they're having any blood pressure issues, things of that sort. But again, we try to get patients up as therapists as early as possible. Limitations in mobility, though, can hamper a person's ability to void and toilet properly. And so one of the names or terminologies that is utilized with that is functional incontinence, whereby patients are not able to get to the bathroom in time because of either pain or mobility deficits. So you may find patients who have had a surgery unable to move as quickly as they normally would because of, the pain, the joint limitations, and so on. Typically, with these types of patients, bedside commode is recommended for use until they can go to the bathroom. on their own until they can tolerate going to the bathroom for that distance and that quickly. But similarly, we also try to implement, or at least I try to implement with most of my patients, if they are someone who has had some type of surgery and they're not home, avoiding schedule. And what that is, based on all the things that have happened, the increased fluids, the medication, and all these types of things, we want to try to allow for the body to kind of get back to its normal self and allow for the bladder to be retrained. So typical voiding is 3 to 4 hours, every 3 to 4 hours. And you want to train your bladder to be able to hold for that length of time. So what we would normally do is start at about 2 hours and have the patient for 1 week and go to the bathroom every 2 hours. And it's a scheduled void. You go to the bathroom every 2 hours. If they're successful going in a 2-hour period and there are no leaks at all, then we would increase that to 3 hours, by a half an hour, to 2.5 hours. So then the following week, they should be going every 2.5 hours. And again, if they're successful, we add another 30 minutes until we can get ideally to 4 hours. But again, if they can tolerate going 3 hours, especially if they're a lot older, then this is perfect. But what that helps to do is retrain the bladder and improve their tolerance with regards to urinating, with regards to activity, those types of things. And it's really important that we try to do this, because if not, we just have people going to the bathroom at all sorts of times. Again, this is not everybody. This doesn't happen with everyone, but certainly this is something that we need to be mindful of with patients who are experiencing these types of issues. Going back a little bit, when we talked about constipation, we want to really make sure that after any type of surgery, if we've had any type of issue that would have impacted our mobility, we want to make sure that we're eating properly, because oftentimes these things will limit our ability to move. And mobility does play a part, or your ability to move will help to facilitate something known as peristalsis in the gut, which is helping the intestines, the movement of the intestines with helping to move feces along. And so sometimes if our bodies are slower and sluggish, whether it is through anesthesia or through lack of mobility, then we really want to try to help as much as possible. So you want to make sure you're getting adequate fiber, whether it be naturally, and that would be ideal. So your raw fruits and vegetables, especially cruciferous vegetables, or using something like psyllium husk. Some people may use a little bit of milk and magnesia, something like that. I like psyllium husk. It's natural for those that can tolerate it. And you'd use about a teaspoon twice a day, so morning and evening. And then also making sure that you're drinking adequate amounts of fluid. So you really want to drink at least half your body weight in fluid. So for example, if you weigh 150 pounds, then you should be drinking 75 ounces of fluid daily. That would be ideal for anyone who is, going about their normal day to day. You will have to increase this based on activity. So, if you're very active, if it's summertime, it's hot, you're sweating more, whatever have you, you may have to increase that amount. But certainly you definitely want to make sure that you're taking in adequate amounts of fluid, because that also helps to avoid things like constipation. You want to avoid bladder irritants. So anything that will irritate the bladder, that can lead to more voiding accidents, more incontinence. So whether it be caffeine, like your teas, your coffees, whether it's sweet tea, iced tea, whatever have you, alcohol. You shouldn't be taking alcohol anyway if you're already taking medication. Spicy foods, dairy, you want to limit that as well. Soda. And again, those types of things can irritate your bladder, so you want to avoid those as much as possible. If you're not able to tolerate water, whether it be because of your medications or other issues, try infusing your water. So you can use fruit. There are lots of infuser bottles on the markets now. And you can do sliced fruit, you can do lemons, you can do mint leaves. Mint is very delicious. I personally like it. You can do lemon, you can do berries, you can do whatever have you, and you get to eat your fruit when you're done. So infusing is a really good way to add flavor to your water naturally, without going and buying a lot of the chemical additives, the waters with the chemical additives and so on. So these things, I'm trying to think of if there's anything else that I have missed. But these things are very important. You definitely want to make sure that you are, creating proper habits with activities on a normal day-to-day basis. Again, you should be voiding regularly within at least a week of your surgery, if not before. Some people may have some retention, but that may be very dependent on their body's response to the anesthesia within those first couple days after surgery. But again, you should be fine. Or if they were catheterized, but you should be fine. If you're having incontinence issues, I would say that it could very well be due to constipation at that point in time. So you want to make sure that you're having, again, plenty of water, lots of fiber to ensure that you're not constipated after your surgery. But again, those are kind of a few of the things that you want to be mindful of, and not just with replacement surgeries, but with any type of major surgery. Those are some of the things that you want to be mindful of. If you've had a major surgery with regards to incontinence, but also urinary retention, should you be having any of those types of issues. Thank you.